everyone, me Utsavi Patel. Welcome back on Unlock ACLAG. So today we are learning about meter dose inhaler, their types and the interventions which we have to be follow as a nurse in our clinical settings. So in meter dose inhaler, there is three types of inhaler: without spacer inhaler, with spacer inhaler, and dry powder inhaler. So, what is the difference between without spacer and with spacer? So, if you're using your inhaler without spacer, then most of the medicines instead of your lungs, it ends in your mouth and stomach. It can't reach to the lungs. But if you are using a spacer inhaler, which is a one kind of a holding chamber which is placed with your inhaler, so, with that holding chamber, the medicines stay in that chamber and then it slowly dissolves directly into the lung instead of wasting in the mouth and stomachs. So, this is the only difference between with spacer and without spacer inhaler. And in the third one, the tri powder inhaler, as the name suggests, the powder is used in that inhaler. That is one kind of a dry powder consistency, and this inhaler is basically used in asthma client, which is directly you act on a lung in that asthmatic attacks, and it acts faster than the same medicine pills because so that's why that inhalers is used. Let's learn how these three types of inhaler used in our clinical settings. So the first one is without spacer inhaler. So we ask the client to stay in a upright position. Then we remove the cap and shake the inhalers. Then ask the client to tilt back head and exhale slowly. Then we put inhalers around 1 to 2 inches away from the lips, pressed it out, and tell the client to inhale through the slowly through it as the inhaler is pressed. Then hold the breath for 10 to 15 seconds and exhale slowly. And with spacer inhaler, the same position, we put the client in upright position, shake the inhaler, attach that inhaler to the spacer, ask the client to tilt back head and exhale slowly. Mouthpiece is tightly sealed through the lips in this inhaler. We pressed it out, inhale through mouth, hold the breath for 10 to 15 seconds and exhale slowly. The third one is dry powder inhaler. So the dry powder inhaler is used, as I say, is in your asthma. And this inhaler use patient has to be breathed quickly as per Mr. Metadose inhaler. And why? Because it is a dry powder, as the name suggests. No, so this powder has to be inhaled quickly and rapidly. So in that way, it reach directly to the lungs instead of that same medicine pills, and it acts also faster than that same medicine pills. So for that reason, this inhaler is mainly used in asthmatic clients. So for this, also remove the mouthpiece cap, engage the liver for the medicines to be available. So there is a one liver aside which we need to be engaged, and then exhale completely. Close the lip tightly around the mouthpiece, breathe in deeply and rapidly through the inhalers. Hold the breath for a 10 seconds and then rinse mouth with water. Breathe out slowly, close inhaler. We need to be disengage that liver. And that's it. For the ACLAC steps, if the client is using a same drugs inhalers, that we need to wait around 1 to 2 minutes between that inhaler used. And if the client is using a different drugs inhaler, then we need to wait around 3 to 5 minutes between that inhaler is used. For the steroids, after steroids use through the inhaler, we ask the client to rinse the mouth with water to prevent oral thrush and oral candidiasis. And if it is occur, then we have to be treated with the nystatin Swiss and swallow. If metadose inhaler is used to administer corticosteroid, then we have to use spacer before it used. because it prevents the medicines being sprayed directly into the mouth, which can lead to irritation and possible infections such as a oral thrush. For an inspiration pattern, in dry powder inhaler, always remember we ask the client to inhale deep and rapidly. And for mid-dose inhaler, we ask the client to inhale deep and slowly. Okay, that's it for mid-dose inhaler. I hope this information is useful in your NCLEX examination. For more informative videos, stay tuned. For now, bye bye, guys. See you in next video.